How long does Suboxone withdrawal last? Suboxone is a prescription drug used to treat opioid use disorder. It is a combination of buprenorphine and naloxone. Together, these two main ingredients work to block the effects of opioids. Suboxone is commonly used in medication-assisted treatment or MAT programs. It is a long-term treatment option that helps people manage their opioid addiction and the withdrawal symptoms that come with it. Those undergoing this treatment will typically wean themselves off Suboxone over several months. If you have undergone an MAT program or are thinking about stopping Suboxone use on your own, you might experience withdrawal symptoms. This video will discuss how long Suboxone withdrawal symptoms last and how to detox from Suboxone. We will discuss what you need to know about Suboxone withdrawal, its symptoms, the detox process, and how to cope with them. Let us get started. Suboxone withdrawal refers to symptoms that can occur when a person suddenly stops taking Suboxone or drastically reduces their intake. Suboxone is a prescription medication used to treat opioid addiction, and it works by binding to the same receptors in the brain as opioids. It prevents the person from feeling the effects of withdrawal while taking Suboxone. However, if you abruptly stop taking Suboxone, you will experience withdrawal symptoms similar to those experienced when quitting opioids. That is because of the opioid nature of buprenorphine, which can cause physical dependence and withdrawal symptoms when you stop taking it. The severity of these symptoms depends on how long you have been taking Suboxone and how high the dose is. However, some common symptoms include headaches, body aches, insomnia, sweating, nausea, and more. Suboxone withdrawal symptoms can be uncomfortable, but they are not typically life-threatening. Remember, the detox process is different for everyone. Some people may experience more severe symptoms than others. If it is time for you to stop taking Suboxone or consider quitting, talking to your Suboxone doctor first is crucial. They can help you taper off the medication slowly to minimize withdrawal symptoms. Your doctor can also prescribe other medicines to help manage any withdrawal symptoms. In addition, there are some things that you can also do to help manage withdrawal symptoms, which we will discuss later on. Anyone who has gone through withdrawal knows it is challenging. Various symptoms can make it hard to function on a day-to-day basis. Withdrawing from Suboxone is no different. Here is a list of some possible withdrawal symptoms, both common and severe, that you may experience. Anxiety, depression, insomnia, lack of concentration and focus, drug cravings, indigestion, excessive sweating, nausea, vomiting, abdominal pain, diarrhea, muscle aches and pains, fever and chills, runny nose, watery eyes, and sneezing similar to the flu. These are just some of the possible withdrawal symptoms that you may experience. Remember, everyone experiences withdrawal differently. In some cases, withdrawal symptoms can be severe enough to require hospitalization. For these reasons, you must talk to your doctor before you stop taking Suboxone. Suboxone withdrawal symptoms can begin as soon as the person stops taking the medication, typically within 24 hours of the last dose. However, they may not peak for several days until 3-5 days. Suboxone withdrawal symptoms can last for up to a month. However, most symptoms will peak within the first week and then gradually subside. Some residual symptoms, such as anxiety and depression, may persist for weeks or months after stopping Suboxone. Withdrawal symptoms can vary in intensity and duration depending on the following factors. How long have you been taking Suboxone? The dosage of Suboxone you have been taking. Your physiology. Your body's dependence on opioids. Now that we have discussed some of the withdrawal symptoms, let us take a look at what you can expect during the withdrawal process. During the first few days of Suboxone withdrawal, you may experience some mild symptoms such as anxiety, depression, insomnia, and drug cravings. These symptoms typically peak around day 3, so expect discomfort during this time. You may also experience physical symptoms such as sweating, nausea, and vomiting. Muscle aches and pains are also common. Remember, some people may experience more severe symptoms during this time, such as fever and chills, diarrhea, and abdominal pain. If you are experiencing any of these symptoms, talk to your doctor. During days 4 to 7, most people will start to feel better as most symptoms begin to subside, especially by day 7. However, some people may still experience peak symptoms during this time. Although most people will start to feel better, it is essential to remember that psychological symptoms, such as anxiety and depression, can persist during and after this period. You may be tempted to retake Suboxone during this time, but you must resist the urge as relapse can prolong withdrawal and lead to further dependence. During this period, psychological symptoms, such as anxiety, depression, irritability, and mood swings, may continue to linger. Insomnia is also common. Physical symptoms should be less severe at this point. However, you may still experience fatigue and flu-like symptoms such as body aches and chills. The good news is that most people report feeling significantly better by week 4. If you are still struggling after week 4 ends, do not hesitate to seek help. You may need additional support to get through this challenging time with the help of an addiction treatment center or individual therapy. Suboxone withdrawal can be daunting, but there are ways to manage it effectively. First and foremost, talking to your doctor about your plan is vital. They can help you taper off Suboxone gradually, minimizing withdrawal symptoms. Additionally, they may recommend other medications to help with specific symptoms, such as anxiety or nausea. You must make lifestyle changes during withdrawal. It includes eating a healthy diet, exercising regularly, getting enough sleep, staying hydrated, engaging in social activities, taking time to relax, making any necessary lifestyle changes. These changes will help boost your energy and mood, making it easier to cope with withdrawal. Finally, reach out for support from friends and family members. They can provide practical assistance and emotional support during this difficult time. They can also help you prevent a relapse. With the right plan in place, you can successfully manage Suboxone withdrawal. Suboxone detoxification is a process of withdrawing from the drug under medical supervision. It usually involves tapering off Suboxone gradually by intaking reduced amounts of the drug over time. And ultimately, it can help people addicted to the drug withdraw and safely achieve sobriety. The detoxification process typically lasts for a few days. During detoxification, people may experience withdrawal symptoms such as headaches, nausea, sweating, and anxiety. These symptoms are typically mild and can be managed with medication and close supervision. Your Suboxone doctor will work with you to create a detoxification plan that is safe and effective for you. Suboxone withdrawal can be challenging to cope with without professional help. Suboxone detox can include uncomfortable and dangerous symptoms, so working with a Suboxone doctor who can help you detox safely is necessary. At SuboxoneDoctor.com, we can connect you with a Suboxone doctor who can help you detox from Suboxone and manage your withdrawal symptoms. With our help, you can detox from Suboxone safely and comfortably.